Some diseases and other health problems are common to both humans and dogs. Others are unique to dogs and other animals. Dogs are susceptible to various diseases, similarly to humans. They can have diabetes, epilepsy, cancer, or arthritis. Infectious diseases. An infectious disease is caused by the presence of organisms such as viruses, bacteria, fungi, or parasites, either animalian or protozoan. Most of these diseases are spread directly from dog to dog, while others require a vector such as a tick or mosquito. 1. Certain infectious diseases are a concern from a public health standpoint because they are zoonoses, transmittable to humans. Viral diseases. Viral diseases in dogs can be serious, especially in kennels. Timely vaccination can reduce the risk and severity of an infection. The most commonly recommended viruses to vaccinate dogs against are a rabid dog rabies CDV, canine distemper, CAV2, canine hepatitis virus or adenovirus 2, canine herpes virus, canine influenza CPV2, canine parvovirus, kennel cough. 2. Bacterial diseases. A number of Leptospira sp. bacteria atop a 0.1 μm polycarbonate filter. Bacterial diseases in dogs are usually not contagious from dog to dog. Instead, they are usually the result of wound colonization. Opportunistic infections secondary to decreased resistance, often the result of viral infections, or secondary to other conditions, pyoderma secondary to skin allergies or pyometra secondary to cystic endometrial hyperplasia. These examples are not considered infectious diseases because they do not satisfy Koch's postulates. For example, Staphylococcus intermedius, a commonly isolated bacteria from skin infections in dogs, would not cause pyoderma when introduced to a healthy dog. In all likelihood, that type of bacteria is already present on the skin of a healthy dog. There are some bacteria that are contagious from dog to dog. The most notable of these are Bordetella bronchoseptica, one of the causes of kennel cough, Leptospira sp., which cause leptospirosis. 3, 4, and Brucella canis, cause of brucellosis in dogs. There are also common tick-borne bacterial diseases, including Lyme disease, ehrlichiosis, and Rocky Mountain spotted fever. Leptospirosis is a zoonotic disease caused by bacteria of the genus Leptospira. Humans and dogs become infected through contact with water, food, or soil containing urine from infected animals. This may happen by swallowing contaminated food or water or through skin contact, especially with mucosal surfaces, such as the eyes or nose, or with broken skin. In dogs, transmission most commonly occurs by drinking puddle, pond, or ditch water contaminated by urine from infected wildlife such as squirrels or raccoons. The liver and kidney are most commonly damaged by leptospirosis. Vasculitis can occur, causing edema and potentially disseminated intravascular coagulation, DIC. Myocarditis, pericarditis, meningitis, and uveitis are also possible sequelae. 5. Ixodes scapularis brucellosis in dogs is caused by Brucella canis. It is a sexually transmitted disease, but can also be spread through contact with aborted fetuses. The most common sign is abortion during the last trimester or stillbirth. Other symptoms include inflammation of the intervertebral disc and eye, uveitis, and inflammation of the testicle, orchitis, and prostate, prostatitis, in males. 6. Tick-borne diseases are common in dogs. Lyme disease, or borreliosis, is caused by Borrelia burgdorferi and spread by Ixodes pacificus on the west coast of the United States and by I scapularis, deer tick, in the rest of the U.S. Signs and symptoms include fever, joint swelling and pain, lameness, and swelling of the lymph nodes. It has been diagnosed in dogs in all 48 states of the continental U.S. 7. Ehrlichia canis, which causes canine ehrlichiosis, and Rickettsia rickettsii, which causes Rocky Mountain spotted fever, are both spread by the American dog tick, Dermacentor variabilis, and the brown dog tick, Rhipicephalus sanguineus.